I can hear you perfect.
Okay, great, thank you.
Good evening, everyone, and welcome to the September 2nd, 2021 special call meeting of the Camden County Board of Education. First, I'd like to ask if there's any consideration of open session agenda changes. Seeing none, yes, Ms. Adlet,
I said I have none.
thank you. Seeing this is a special call meeting, public comment session for special call meetings requires board action for approval of any public comment under policy 2310-B. Is there any such motion to bring to the floor?
Motion.
Motion by Dr. Banks to suspend public comment.
Sorry, to allow?
Yes. Suspend the policy on public
Yes.
comment for special call meetings to allow public comment this evening.
Second.
Seconded by Mr. Purcell. All in favor, say aye.
Aye.
Opposed? Motion carries. All right, so that we will add on our agenda, public comment as item 1A. Ask if there's consideration to approve the agenda as amended. Motion by Mr. Purcell to approve the September 2nd, 2021 special call meeting of Camden County Board of Education,
Second.
seconded by Mr. Heath. All in favor, say aye.
Aye.
Opposed? Motion carries. Public comment. Citizens who signed up to address the board will be called up in sign-up order. Each individual speaker will be allowed 3 minutes for remarks. Issues or concerns involving personal complaints related to identifiable school personnel or student matters are not appropriate for this public forum. After 30 minutes of public comment, any speakers remaining will be recognized at the end of the agenda. I will be using a timer this evening, so after 3 minutes, you will hear a buzzer. If you will please be respectful and end your comments at that time. Thank you very much. And first is Ryan Cooper.
Hey guys, I'm here again to reiterate the no mask policy. I'm here for I have 1,000 words I could say to you. I'm trying to get that in this short amount of time. Every morning I drop my kids off at school. I don't see a lot of mask wearing. 90%, I would say at least, of the public that I see aren't wearing masks. We are relying on tests that doesn't even test for COVID-19. I've had the virus, but the numbers are showing that the cases are going up. Why are we worried about cases? Why aren't we more worried about sickness? When before all this, it was, 24-hour fever, you're good as long as you ain't had a fever for 24 hours. You can go back to school. We're sending kids home that have just been supposedly exposed to other people that have had the virus, or may have been exposed at home, or exposed during gym, or exposed in their car. I don't know. It's this invisible fear that we're all having of this thing that is causing harm to our children. I mean, it really is. I'm in this county because of our school systems. I'm trying not to get too rowdy here, but once again, there's 1,000 things I want to say. I don't see the purpose of the mask. We are 18 months past this all started, and you want to put the kids back in mask again. The counties around us are in mask, and they're having the same problems we are, the same cases. It's all about numbers. It's all about numbers. And those numbers are coming from the test that don't test for the virus that we're scared of. I mean, I'm sorry. This is ludicrous. And I'm sure there's people that have put their kids back in the school system because we went maskless. I pay taxes in this county. I feel like I am a good citizen. My kid's sick, I'm not sending them to school, but we're sending kids home that are not sick because we're scared. This fear of this thing is just it's getting frustrating. And I'm speaking for the 90%ers out there that want the kids to go to school normally and want to have the education they deserve. I don't want to go remote. That's the next step, is remote. I'm sure y'all discussed that. I'm sure other counties have discussed that. But how you've got kids that are so far behind that my son tells me that they're going to let kids out of school on Fridays at 1 o'clock to catch some of the other kids up. I don't know if that's true or not. I don't know. He said that. I don't know if that's true or not. I'm sure he wants to be picked up early. I'm sure. I don't know, but it's frustrating to see what I see. And then we're going backwards. Every morning I drop my kids off. I've done that for 10 years now. I'm the parent that drops the kids off. I don't see masks but 10% of the time, and I like seeing smiling faces because that's the teachers too. Thank you.
Hey guys, good evening. So last time I spoke 2 weeks ago on August the 12th, and I was advocating for my children. Tonight I'm advocating for my friends, and I'm advocating for this community who I love. When I spoke last week, I'm not wavering. Masks do not work. I am completely against masking these kids up. Elizabeth City Schools is proof that masking does not work. Your website says 1 new teacher case, 18 student cases, 112 quarantine. The positive cases is 1% of your student body. Why is masking our kids an option for 18 cases? To my knowledge, no one has been hospitalized, and please forgive me if I have misspoken. You guys masked up these kids for 9 months and through the summer last year. Some kids haven't been out of their homes in a year due to remote. What did you think was going to happen? Kids are germy. They get sick at school. You guys are quarantining kids because they complain of a headache or a tummy ache, and you're demanding a negative test to return. No one should have to test their kids if they aren't sick. Are kids not allowed to have the common cold or allergies anymore, or has that disappeared along with the flu? There are kids sitting at home right now with negative test results ready to come home back to school, yet they aren't allowed. Why is that? Parents want to help. It is my understanding that at least 80% of these kids are unmasked. That speaks volumes. There has to be a better solution other than masking our kids. The toolkit mentions 3-foot social distancing. Is that an option in these schools? Another option in the toolkit is antibody testing to avoid being quarantined. Will you guys allow that? I was sick in December, and I just took an antibody test at the hospital, and I have COVID antibodies. My son Cole has COVID antibodies. I would also suggest creating groups of 4 for the elementary kids. My point is, we have to use critical thinking. We have to come up with a solution that is safe, effective, and unmasked. Projecting fear or personal opinions onto our students is crossing a boundary, and I'm asking the board to consider implementing a policy that protects the students from fear-mongering and or harassment from employees in this district. In my humble opinion, if someone is scared of a virus that has a 99% survival rate, maybe the school setting is no longer a good fit for them. If a teacher would like additional PPE, Locks would be happy to donate some safety equipment. In 2019, there were approximately 63,000 people in 3 counties, Camden, Elizabeth City, and Perquimans. Albemarle Hospital has 182 beds, including the ICU, and it services these 3 counties. So critically thinking, if all 182 beds of that hospital was full of COVID patients right now, that's only 0.28% of that 63% population. That's not the case right now. As of Tuesday, August the 31st, there were 21 positive cases admitted in the hospital, and 8 cases were pending test results. That is 0.033% of that 63,000 population. We have to move on with life. We cannot stay here forever. Our kids deserve more. Thank you.
Greg Warren.
Well, looks like the same 3 people speaking as last meeting. I'm going to continue to take the opposite side of the argument here. I'm a physician. I've been in Albemarle Hospital. over the past several weeks. I've watched several more people die of COVID. You're right that we're lucky in a sense that our number of patients is small compared to a lot of other hospitals. But to think that our number of patients doesn't take a significant toll on our medical staff, our nurses, you're kidding yourself. I've seen nurses on the verge of tears. I've seen doctors working overtime. These patients that are coming in now are younger. They're sick. For the most part, people who haven't had the vaccine. We're seeing it in the outpatient realm as well. We're seeing patients that are sick, not quite sick enough to go in the hospital, but sick. I think that our community is still in the throes of a serious pandemic, and I think that this virus is serious. I agree that we should not make our children afraid of this virus. Fortunately, children do not seem to get as sick, although with the Delta variant, we're seeing more sick children than we did before. I'm thankful that I haven't heard of any really sick kids in our community. I don't know if I would know because most of the sick kids go to Virginia, but I'm thankful that I haven't heard of any. What I have seen is sick kids spreading it to their parents and parents getting really sick. And I do think it's a reasonable side of the argument to ask that kids mask to help lower the overall spread in the community. I think that part of the reason the health department has recommended this, the governor has recommended this, part of the reason that the majority of the school boards in the area have changed their minds is that they're seeing the numbers go up in the community and they want to help out and help lower the spread. I do think that masks help some. I don't think they help 100% or anywhere near, but I do think if you can lower the number of cases, it helps take the burden off the healthcare system, and it does help potentially keep some adults who shouldn't be getting sick from getting sick. Do masks put a burden on kids? I suppose that they do. I suppose that it's not fun for kids to wear masks. It's certainly not fun for adults to wear masks. But the way I look at it with my children is I don't think it's a lot to ask for them to wear masks if it helps prevent the virus from spreading to other people. My only ask after sitting through the last meeting is that we hear from the board members. I'd like to hear why you're voting the way you are. I'd like to hear the evidence you've reviewed, the sources you've gotten your information from, because I'm up, sorry.
Camden County Schools COVID mitigation plan updates for 2021. Superintendent Farrell?
So thank you to the five of you for lots of spirited debate this week and questions and little digging out of data and all that brought us to where we are tonight. Some of your questions that you asked this week in reference to what's happening in our schools right now, I've shared with you, but I want to share a little bit of that information this evening as well. So one of the things that we are striving to do is keep you all updated about our total number of COVID positive cases, separated out by staff and students, as well as by school. And so as of this afternoon, we, across the first 2 weeks of the school year, we have had a total of 12 positive cases among staff. 9 of those were at Grandy. None of those were at CIS. One was at Camden Middle. The 2 high schools did not have a positive case, and there were 2 positive cases at central office. Looking at quarantines for staff, there were a total of 10 additional staff members quarantined, 4 of those at Grandy, none at CIS, 3 at the middle school, 1 at Camden County High School, none at the early college, and 2 at the central office. Going back and looking at COVID positive cases for students, there were a total of 33, 7 of those at Grandy, 6 of those at CIS, 3 at the middle school, 12 at Camden County High School, and 5 at the early college. And of course, we don't have any students at the central office. And then looking at the quarantines of students over the course of the first 2 weeks of the school year, we've had a total of 291. 65 of those were at Grandy, 51 of those at CIS, 58 at Camden Middle, 107 at Camden County High School, and 10 at the early college. Are there any questions about any of those numbers? One of the other things that you all had asked for some information on that I thought would be important to share for you as well as the public tonight is substitute teacher information. Typically, so about, I guess, maybe 6 months ago, I actually had someone come in from a company that guarantees to raise your fill rate of substitute vacancies in a classroom because of a teacher absence and fill that position with a substitute during the absence. And one of the first things that person asked me for was, well, what is your fill rate? And I said, I have no idea. So I asked HR, what is our fill rate? Well, it turns out that our fill rate was 100%. So I really didn't need to have this conversation with this gentleman. And so we're very fortunate in Camden that typically we have a 100% fill rate. And so last summer, before the 2021 school year, all of our subs were contacted, and a lot of them said, you know, I'm just going to take this year and not come in and sub just because of all that's going on with COVID. And so then this year started, and we have had some days with a 100% fill rate. We have also had some days with an 80% fill rate, 71% fill rate, a 50% fill rate, and the lowest that we've had, and again, this is across just a couple of weeks, and tomorrow is still another day in the second week, but 44% was our lowest fill rate. So Yolanda Anderson in Human Resources called all of our substitutes to say, you know, is the system working correctly? Are we getting any, are you getting the calls? Why are you not picking up the jobs? And what the feedback that she received was that our numbers are too high. And so a lot of our substitutes, to answer your question about whether or not we're filling all our substitute vacancies, is that we are not. Now, our principals have done a great job of having people covered during their planning, you know, school counselors, teacher assistants, and different other staff members. But of course, when that happens, those people are being pulled from other places in the building. So any questions about substitutes and the fill rate?
I would still have some concern about resorting to a third-party company such as that.
Oh,
You know, speaking to people from other districts who have transitioned from being a substitute as in a type of system we currently have versus a third party, the substitutes themselves are not as satisfied and they're less likely to take the position. So I'd say we need to do some more research before we would want to move into that.
yeah. And I agree with you 100%. That is, I just wanted, I really kind of use that as an example to remind you all that we had done that and looked at that, but we actually didn't have a problem for those people to solve for us. And so our hope is that once COVID is behind us, that will be the case again. So taking a look at the COVID mitigation plan that you all approved at the last board meeting, after a lot of discussion with the five of you and individually and with members of staff and all that, I want to go through this again like I did last time and identify some changes that we that we have added to this, and of course, ultimately a decision about those things will be up to you. And so one of the things that we've talked about is limiting visitors in the building. We are noticing, especially when parents are getting calls about quarantine, their child is quarantined, they want to come in and meet with someone to get information. And so then we're bringing more people into the building. So in addition to the signage that we have about washing hands, avoiding touching your eyes and nose and things like that, using hand sanitizer and just general things, we would add signage to limit visitors to our buildings and ask that that those individuals make an appointment with the principal or with the principal's designee before they come into the building. There's been a lot of discussion about face masks, and what we have added to the mitigation plan is, except where social distancing as defined in the North Carolina Public Health Toolkit, except where that can be accomplished, then we would ask that students and staff wear a mask. And so an example of that might be, let's take a first grade class. So we have a teacher and 16 students in a first grade class and a teacher assistant part of the time. If Mr. Lazar is able to place desks in such a way in that classroom that they are 3 feet apart, which is what's currently defined in the toolkit, while those students are seated at their desk, they would take their masks off or not be required to put them on. If they were put into a small group to do some type of group work, or what I referred to earlier today as carpet time, or when they're in other areas where they cannot maintain that social distancing, then the signage would require that those students put on a face mask. And so under the masking section, except where minimum social distancing as defined by the Strong Schools North Carolina Public Health Toolkit can be achieved, Camden County Schools would mandate a mask for use for all people regardless of vaccination status. And the reason that we have added that to this toolkit or to this plan is very simple. We do have a high number of quarantines. Now they are low percentage-wise. We've quarantined about 17% of our students across 2 weeks when you look at the numbers that we have. And so if you read the latest version of the toolkit, that it does change a lot, but the latest version was released on August 26th of this year. That toolkit will give 3 exceptions to quarantining. One of those exceptions, and I am skipping around a little bit, so forgive me on that, but one of those exceptions is if a person or if a student has been fully vaccinated and do not have any symptoms, then they do not have to quarantine, even if they have a close contact with a COVID positive person. The other or another is if people who have tested antibody positive for COVID-19 or have had COVID-19 or recently or within the last 3 months and have recovered and do not have any symptoms, then those students would also not have to quarantine. And then students who are not fully vaccinated after a close contact in a classroom or other setting, if masks are being worn appropriately and consistently by both the person with COVID-19 and the potentially exposed person, would not have to quarantine. That applies to classrooms, other in-school settings, and transportation, but does not apply to exposures during extracurricular activities, including athletics, and it does not apply to adults. So that number of 291 students that we've quarantined over the last 2 weeks, 17% of our student population, that would take a significant dive if we can maintain 3 feet of social distance, and when we cannot do that, that they are masked. And so that is the reason that we added that back for your consideration in this document. Physical distancing, that seems to be a little bit of a changing thing. It was 6 feet and then it was 3 feet, and now there's rumor that it might go lower than that. But we have, in the change that we made, is that Camden County Schools will maintain the minimum distance as defined in the Strong Schools Toolkit between students and adults within school settings to the greatest extent possible. There are places in our schools where we just can't do that. And so because of the number of students in a class, the square footage of the classroom, or whatever the case may be, it's just not possible to do that. But there are places in our school system, a significant number of them, where we can do that. There were no changes to the transportation section. One of the things that we would ask in this COVID mitigation plan of teachers is that where possible, to maintain the minimum distance as defined in the toolkit of 3 feet, so that students are, when they can take the mask off, or when they're within 3 feet, they would have to put it back on. Again, there's more discouragement of, I said earlier in the week, I'm not going to get into the business of telling teachers how to teach. They're the experts in that, but we would discourage teachers, or encourage teachers rather, to do activities that would not bring students together in groups where they're less than 3 feet apart, but with the understanding that we know that some of those activities are going to take place and they need for those to take place, but we would ask that they have a mask on during that time. And so those are the changes that we made to the toolkit. But there is one additional one that I almost forgot. So when I originally brought this document to you all for consideration, the North Carolina High School Athletic Association had guidelines for us to follow, and they no longer have guidelines for us to follow. They've left that up to a local decision. And so after a lot of discussion, what we have is Camden County Schools will allow students the opportunity to participate in athletics, school programs, and extracurricular activities. During athletics, school programs, and extracurricular activities, audience members, inside spectators, administrators, athletes on the sidelines, and coaches would be required to wear a mask. However, while students or athletes are actively participating in sports or school programs, they would not be required to wear a mask. And then extracurricular activities such as club meetings, attendees would be required to wear a mask at that time. And then, of course, when we are traveling as a sports team to another district, we would need to follow whatever the rules are in that district instead of going there and bringing our rules with us. So those are the things that we have added to the COVID mitigation plan to get your discussion started.
On the athletic one, for audience members, spectators, it says inside spectators. Is that to apply only to inside sports, or say the football game outside as well? I just want to clear the way it's written. I want to clarify what we're
All of our masking that we put in here is indoors.
strictly for indoors.
Yeah.
Okay.
Any others?
If you wanted to start, I'll go. I said, no, if you wanted to start, I'll go for discussion on
Questions?
Questions,
I mean, I
discussion.
do, if we could go back to our cases and quarantines, do we have it broken down so that, do we have a breakdown of the cases who could be traced to school versus outside sources, quarantines from school versus outside sources?
I might need to phone a friend in the audience for that. Ms. Lane, did you hear what he's asking?
He does not broken it down on outside space, spaces within the school. We can,
Is it feasible to do so?
It is. I can speak for my school, because I know mine are. We haven't had any positive cases that have been transferred within our school. All of our positive cases have been contracted from outside sources. So we haven't had a student give another case to another student within the school. They've all been contracted from a family member, a sibling, something like that. None of our positive cases have been passed from, an outside source. We'll call and say, Johnny has contracted it from another source.
Any idea on quarantines as far as outside versus
Now, we
exposure?
had lots of quarantines
Lots
within the
of
school.
quarantine.
Exposures from in-school sources.
Yes, yes, sir, we have had a lot. We've had some outside as well. But our kids have 4 classes a day at the high school, so when you're in a class, you've seen the size, next to the high school. You've seen the size of our classrooms.
What was that? Sorry.
Yeah. You've seen the size of our classrooms, and we have more students right now than we've had in the 21 years I've been, in the school system. So we have classes of 32 and 34. So you're looking at 5 or 6 students per positive, case. So you're looking at 4 classes times 5 or 6 students every time you have a positive case. So it's 20 to 30 students quarantined every time we have a positive case.
So can I dive in just a little bit more if you have the answer? How many around about of those cases are ones where a student has stayed home, but the nurse has possibly gone back 48 hours and said, okay, these kids were exposed in this 48-hour time period, versus a kid who comes to school symptomatic and creates exposures while they are in class?
I don't have a breakdown of that numbers. We've had a mixture.
We have had a mixture, but we can get that for you.
I could get that for you too, but it has been a mixture. And I will say, we do have students coming to school who we can say they've come 2 or 3 days and they have been sick. And they can say they've been here a couple of days, and that has created issues.
So it's very prudent to remind parents not to send children to school sick because it affects
Yes.
a lot.
Yes. You can have one case and I can send home 30 to 40 kids quarantined because of one student who's a positive case.
But even with these mitigation measures should practically eliminate that.
Not just prudent that if they don't come to school sick. I had COVID back in October last year. Had it, only one in my house got it, thankfully. Wife and kids pushed them out, go away. I remember distinctly the health department telling me everybody in my house was to quarantine some way, shape, or form. They went to a hotel, so they weren't around me because I had been at work for a couple of days before I came home with it. Don't send them to school sick. And if someone in your household is positive, do not send them to school whether they are sick or not. They're to be quarantined, isolated, whatever word we're using from the health department now. That has been a result of at least 1 or 2 of our groups of quarantines as well, that a parent had it or a sibling had it. Well, they don't have it, so I send them. They ended up getting it, and we had to trace back and track back and send people home for that. Yes, ma'am. Absolutely.
So I've been working in the school district
For 21 years as a school nurse, and this is my 2nd year working in a pandemic. And I can tell you, without a doubt, no matter how many times you tell a parent not to send their children sick, it is going to happen. You cannot eliminate that. That's a mitigation measure, yes, reminding them, but it's still going to happen.
Anyway, that being said, that being said, had those 2 cases where they were close contacts at home, came to school, then ended up getting positive because they were close contacts at home. Had they been under the new guidelines of both parties masked in school, would not have taken out our 30 to 40 kids on either one of those instances, correct? That's the way the new toolkit, okay. And I haven't forgotten about y'all. I'm going to go through and answer a lot of what y'all got up here and either wanted to know or asked us to explain, and et cetera, et cetera. So the reason we have 15 to 17% of our kids out now is because the state of North Carolina says we have to. We have to quarantine them based on those guidelines that were given to us when we took our original vote 3 weeks ago. They changed it on the 26th of August to allow this new flexibility of if both people wear masks, only the sick person goes home. So hence why we have so many kids out right now. Remote is not anywhere on this board's agenda, conscience, anything. It's not been discussed other than if we have kids who are quarantined, do we have a virtual option for them, which is being developed. I understand we're fine tuning and getting that ready to go. Nobody on this board wants to go back remote or virtual or hybrid or anything else. I'm sorry.
Nor the superintendent.
Nor the superintendent. I'm sorry, I'm trying to get back down everybody's question. No, we don't have the room to 6 foot distance. We didn't. We have the room now in some schools to go to the 3 foot mark, which is now allowed, not all of them. So no, we don't have that room.
So if you're in a classroom with 27, 28, or 30 kids.
Right. It's mainly GPS is the only one that has that kind of room because the state mandates they can have no more than 17 kids in a K through 3 class. There's a state class size law that requires they have to only have this many kids. And because of this growth that we are now at the highest number, I think in history, we've added an extra 2 or 3 K3 teachers just since school started because of how many new kids we have in the system. So no, we don't have the room. Why did I vote the way that I did earlier, Dr. Warren? The toolkit that we had at our last meeting that was presented to us by the state down through the superintendents to us did not make an exemption or an exception whether a student was masked or not. If they were within that 6 foot radius for more than 15 minutes, they were to be quarantined regardless. If I'm going to have to send the kid home anyway, then absolutely, why wear the mask? There was no point in it because it was not going to solve any of the quarantining problems. Whether it reduces transmission or it doesn't, I'm not here to debate with health, medical, follow the science, follow the left, follow the right. Not worried about all of that. My bottom line is keeping kids' butts in seats 5 days a week for the entire year, if at all possible. Why are we discussing masking? Is that 291 kids we have out on quarantine? Because that policy will allow us to almost virtually eliminate probably 90% of those. There were a few that were contracted due to sports events outside that would not fall under the exception. But I can speak for the board. I'm pretty sure I can speak for most of our parents in this county. Nobody wants to go back to virtual or hybrid at any cost that we can avoid it. And if in doing so of not having to quarantine 17% of our kids in the first 2 weeks, that's why we're having this discussion on whether to require masks tonight or not. It's not whether we think it does or does not transmit, cause it not to transmit. It's simply 17% of our student population in only 2 weeks has already had to be out due to exposures that we now have a guideline that was just released last week that we can prevent the majority of those exposures. So I tried to jot down as y'all were asking this question to try to answer them. That's the reality of where we sit tonight with what the guidance that came out last week has changed and why it so dramatically changed. All the surrounding boards around us as well have now switched their stances because we're all seeing an increase in number of quarantines just because we don't have a choice. The state says you have to. And that's why we're having this discussion tonight about whether to implement some new version of a masking policy, if we can still do it, whether it's through the 3 feet that Dr. Farrell has recommended tonight or universal or however, some way to keep as many children in person all year as we possibly can. That's my goal. I can't speak for them on that. That is the reason I'm discussing this tonight. I don't want any more kids out that aren't sick than have to be. If only the sick kid goes home and 30 or 40 other kids get to stay in school, I'm okay if I'll get crucified for my decision later, but those 30, 40 kids are still in school every day. And that's what I'm here for.
Yeah, I feel the same way as you. We've talked about it. We're on the same.
Yeah, I'm not arguing science versus politics versus whatever. Anyone who knows me personally knows my views on that subject, but I can't in good conscience not at least discuss the option of keeping 17% of our kids back in school every day. Yes, sir.
So it's September the 2nd. I'm talking about December the 2nd. What if the cases stay the same or if it become more, that it increase? What is the next step? Because you're putting masks on the child to prevent cases to come down. What if they go up?
I don't want to put a mask on our child. I want to prevent quarantines, solely to prevent quarantines.
So what if the cases go up? Are y'all just going to maintain the same level, or you want to change policies?
Well, the bill,
The Senate bill legislation that passed is we have to revisit.
At least
the
At least
masking
monthly.
policy, whatever it is, has to be revisited once a month to coincide with changing cases up and down. Basically, our regular board meeting every month, yes.
So you have a meeting every week to decide what needs to happen.
We have to revisit this policy every single month by law. I can't speak to it if cases continue to go. Last year, we had quite a few cases, and we still managed to stay the first half hybrid because we had to. The second half of the year, even though we had cases, we still stayed 4 days a week. And that's my commitment. I want 5 days a week the rest of the year. And I'm 99% sure everybody sitting up here wants that same thing. If we hit a point where half the school is out because they're positive or half of our staff is out because they're positive, I can't speak to what we do because we don't know. But I do know nobody is trying to even have a discussion about remote or virtual or hybrid learning for Camden County school system unless we have exhausted every other possible option we have available to us. And I can tell you that from speaking directly to each member of this board, nobody wants virtual, hybrid, or remote in any way, shape, or form unless we absolutely have to. And I know that doesn't answer it, but that's the best I can give you because I don't know. If half the school and half the staff is out, we have a problem. We're going to have to revisit. But I can tell you,
The pressure you're under. I understand all
and
that.
it's not, and I'm not. I don't mean to sound like I'm getting amped. I'm that passionate about wanting as many kids in school as we can keep, and that vehemently opposed to having to go back to virtual.
We're the same boat. I completely understand. My thing is, it's very frustrating to see progression and then see 3 steps forward, 2 steps back. You know what I'm saying? That's as a parent, I love my children, and being able to go to school and drop your kids off and see the smiling teachers is a wonderful thing to see.
I agree with you because I drop mine off or pick them up just about every day of the week, and I'm not at my 24-hour shift. So I agree with you 100%. Chairman, there's one in the back there. I'm sorry I took over. I want him to speak. I apologize.
Yes, ma'am. Do you have a question?
I have a concern with the interpretation of the updated movement on the 26th. It does give exceptions to quarantining to include that, like if someone is masked. It says nothing about a distance of 3 feet. If you look at the toolkit and you look at cloth masking, and then you look at their physical distancing guidelines, and then you look at the exceptions state that if they are following the guidelines as laid out, and it says that for unvaccinated students, that they should be greater than 6 feet apart. It also says that they understand that while eating, they should try as much as possible to be 3 feet apart. But if children are sitting within a classroom within 3 feet unmasked, then that does not qualify under the exception, for not quarantining.
Correct. And that's why the discussion is to have all children who cannot maintain 3 feet wear masks.
But it does not give the exception to prohibit or to alleviate quarantine, even if they're 3 feet apart. That is not in the toolkit. It says if they're not wearing masks. And any recommendations for masking is universal mask.
Which
So I think we need some clarity.
version of the toolkit are you reading?
But the toolkit that's updated August 26th, I'm reading it online. It was also sent to me by a school nurse, so I have it right in front of my face. I can tell you all 3 pages that it refers to.
Ms. Berry, is that do you have any input?
I don't have it in front of me. I do. There's something on page 9, and there's something on page 14. I believe it might be 16. I'm not sure.
9 fall face coverings requires all students and staff in K through 12 to wear face coverings consistently when indoors. Then it goes on to say that because students cannot mask consistently during meal times, they should maintain distancing of at least 3 feet to the fullest extent possible when actively eating. Continue having meals outside where the risk of the virus is low. Then you go on to page 11, physical distancing and minimizing exposure. Maintain a minimum of 3 feet distance between K through 12 students who are not fully vaccinated within school settings to the greatest extent possible. It does not say 3 feet and then take masks off. And then if you go to page 15 where it gives, no, I'm sorry. Yes, 16 where it gives you the exceptions. It says nothing, it says students who are not fully vaccinated after a close contact in a classroom or other, sorry, I need some water, but I don't have any. If masks were being worn appropriately and consistently by both the person with COVID-19 and the potentially exposed, that gives you the exception. It doesn't say unless you are greater than 3 feet apart. It says you have to be masked appropriately. And according to the toolkit, appropriately is everybody inside. I just thought it was pertinent to review it because if you're gonna state that, y'all are held liable to hold those standards by the state.
Yeah. Most of us have read this thing about 20 times recently. So.
Well, I believe it's still a recommendation, not a requirement.
It's remembering
Right,
that
but the whole point is keeping the quarantines down and keeping the kids who need to be in school.
I'm not here to argue
And
my.
this is on page 16, Dr. Bates, if you have it.
If you want to increase the instructional time per student, that means those 9 teachers that they need would be face-to-face with their students, mask or no mask. And that means all the students who are quarantined would eat it. If you do universal masking, you can prevent the majority of those quarantines. And that is the way to increase your instructional time with your kids.
this might be a matter of, remember when the language in the toolkit changed from required and recommended to should and could? If I'm understanding
So
it correctly.
see, what you're going by is page 15, 16?
Page 16 is
16,
the third bullet down.
Mm-hmm. So on page 14, as of 7/9/21, there's no record of it changing since then, as this is the most updated. CDC added an exception to the need to quarantine in the close contact definition, excluding students who were within 3 to 6 feet, 3 to 6, of an infected student, where both students were engaged in consistent and correct use of well-fitting face masks. So if you are within 3 feet and both wearing a face mask, you are exempt. That is an exception. If you are outside of 3 feet, that is not an exception. You don't need an exception.
Didn't you just say 3 to 6 feet?
It says 3 to 6 feet, and the 6 feet applies to adults, other places in the toolkit, not children.
You see that?
People who are not fully vaccinated may quarantine after recent close contact with someone with COVID-19. Close contact is defined with the case is defined as being physically exposed within 6 feet of another person for 15 minutes or longer, cumulatively. That's within 6 feet. We can't 6 feet distance in our schools.
Right, but right below that is the note where it specifies students are 3 to 6 feet.
Okay.
Adults are still 6 feet.
Well, I've been in my private third grade classroom, and they're not 3 feet apart.
Well, if after today, either they will be or they'll be masked.
And that teacher is going to say, okay, I counted the time when that student took their mask off, and that student was around.
If they're outside of 3 feet, then if the teachers have desks spaced 3 feet apart, I really thought about bringing a yardstick with me tonight. If the desks are spaced 3 feet apart and the students are at their desk, there shouldn't have to be a time clock. If those students get up to move, to go to another classroom, go to the bathroom, wherever, they should have a mask on, because that again eliminates the time clock need. It's not like, hey, I'm going to go sit with Kevin here and work on a project for a little while, and the teacher's got to keep a time limit.
I agree with you.
It's either I'm here, or if I'm here, I got a mask on.
But last year, when they were mandatory, and the number of teachers that posted pictures on JoJo and social media of unmasked children in the classroom, when it was required at all times, if that's the standard that we're going by, then that's not acceptable.
It's going to have to take responsibility on everybody's part, the teachers, the administrators, us. So, I mean,
there's no way you're going to be able to have a classroom full of kids and make sure they're all maintaining 3 feet.
Just never, I mean, even the vaccine, it's not, kids under 12 can't have a vaccine. So, you know, we're going to keep on going around in circles here. I mean, either we try or we don't try.
either we try to live within the toolkit,
Right.
the governor's scientific toolkit, or we don't.
Mr. Lazar. I know Ms. Davis usually went on the hot seat because it's always the high school stuff, but it's your turn this time. What? I'm sure you've discussed this with your staff and faculty. What are their thoughts on their ability to, if we can set the distance for 3 feet, being honestly and realistically being able to keep track and keep the kids either separated or masked when they're moving about? What do they truly think? Is it something they think is doable?
Letter of the law, we cannot guarantee you 100% when they go to the bathroom or at recess or in PE, 100% we cannot guarantee that they're exactly 3 feet apart all day, every single day, to the letter of the law written by that. I will tell you that we spoke to the health department today and the regional consulting for nursing. And it was very exciting to hear 2 kids were working together less than 3 feet and had a mask on. Only the one that tested positive had to stay home. With the mask is the debate, but having those 2 kids that work in those small groups is more normal to some degree, and getting back to that normal, and if only one has to go home, that's great. So I think there needs to be a compromise of when, because if they're at their desk, 3 feet, we could do that with our class size and our desk. We can do that. But I can't guarantee in all these other settings that.
But there's also another factor involved. You still have the 15, sorry, I was speaking. You still have the 15 minutes. So even a child, for your example, going to the restroom, I mean, if a child's going to the restroom for 15 minutes, somebody's going to go check on them, I would hope. So you still got, say, okay, they were 3 feet away for 2 minutes and they all of a sudden got closer for a minute, 2 minutes, 1 minute. 15 minutes is still cumulative. Still hard to say, hey, if we're following the rules.
When you ask someone, were they exactly 15 minutes apart? Ask, even if you have your 2 kids, how close were they for 15 minutes in the backyard? Now I have 18 kids. But we can't ask our teachers to do that. I know that's not what you're asking, but to maintain, we're 100% sure that they were not 16 minutes or 12 minutes.
But you could also say we make the best efforts to enforce our rules and regulations as much as possible on the opposite side of that.
What is your?
on the 3 foot. So.
I think the way Dr. Banks interpreted, the way I interpreted it, that it creates the exception. The exception has been reduced from 6 feet to 3 feet. That's what I think that language means. So that students who are, and that's different than what the health department said or the regional consultant, but I read this to be that there is an exception to the quarantine requirement when students who are within 3 feet do not have to quarantine if they have these except if they have been properly masked with correct and well-fitting masks. Other K through 12 prevention strategies are applied in that setting. Then the student who does not test positive does not have to quarantine. That's how I read it. And if they're outside the 3 feet, then it doesn't matter. There's not a quarantine requirement. This is only this is the exception to a quarantine requirement that applies to this narrow circumstance. Because you got to remember, close contact is being within 6 feet for more than 15 minutes in a cumulative 24-hour period of time, whether you're masked or not. And that's the adult standard. What they've done is they've changed the close, they haven't redefined it, but what it amounts to is a redefinition of close contact.
For kids.
That's reduced to 3 feet instead of 6 feet.
Same, yeah, they're giving students way more leeway. Same thing with the mask. The masks protect them, but they don't protect
So that's what
from quarantine.
So you're not going to be considered to have been in close contact if you're more than 3 feet apart, or if you're within 3 feet and you follow these restrictions. That's what I think the intent is.
And there's probably, if we adopt these guidelines, there's probably gonna be more students who, in the timeframes in which they could remove their mask, there's probably gonna be more kids who will keep a mask on. Peer pressure is a bad thing. And, if there's a few kids with mask on, the others might be more inclined to wear a mask if they're kind of on the fence about it. And I mean, as parents, we got to tell our kids what's best for them, from our opinion.
So basically what you're saying is if you're in a decent sized classroom with a low number of kids, Brandy K3 setting, while they're at their desk, if they maintain that distance, they wouldn't have to wear a mask.
Correct.
But if they get out of their desk, they need to go ahead and put it on.
Yeah.
Just to be safe. So just basically while they're at their desk, if they maintain that distance, which is probably only going to be Grandy because the rest of our schools are packed like sardines. So.
But if you're in class with 30 kids and you're not 3 feet apart, then that whole
Everybody
has to wear a mask.
Yeah, basically this.
Correct.
Yes.
Correct.
Yeah.
This, the way that policy is written, and it's nothing against our middle school, even CIS and high school principals and early college principals, is only going to fit Grandy, is possibly meeting that criteria. And that's not even a guarantee. We have too many kids in the other schools with too small of a classroom. It's just not going to happen. But yeah, if they cannot maintain 3 feet, Christian and I are from center to center, 3 1-foot squares away from each other right now. So if they can't maintain that distance while sitting at their desk in the classroom, they would have to be masked. If I'm sitting here and I get up to go to the restroom as I just went to turn the air back on because it's hot in here right now, I would have to put a mask on, go do what I did, come back, sit down, then I may remove my mask again. That's the intent, what everybody is understanding this policy, the way it's written.
And if I may add one thing, Mr. Purcell, all of our principals have shared this information with me because I wanted them to be prepared for this very question tonight. It seems from the information, and any of the 5 of you can correct me if I'm wrong here, but there are places in all of our buildings where it can be done. Now, there are a lot more of those places in Grandy, or those spaces in Grandy, than there are in the other schools. But if it could happen in some spaces in all of our schools.
Yeah, like maybe a calculus class where you got
Just
10
a lot
kids in
fewer
there.
of them, yes.
You had a small student population.
Then my concern becomes ambiguity for the staff that's having to keep track of which period is it, what class are we going to,
Yeah,
I don't want to put on them too of having to go back and forth about mask, no mask, mask, no masks, moving about the school.
Consistency, and I'm not a fair, life's not fair, I'm stuck in a buttercup kind of girl, you gotta deal with life sometimes. And my thing is, one kid has to wear a mask all day and then another kid doesn't because they have 4 smaller classes. I kind of see that it's not a consistent and fair thing. So that does concern me somewhat. And it could happen. And honestly, I'm gonna have like 5 classes here that you don't have to wear a mask in. But there are some places with that, so I do see consistency, kind of being a problem here.
And it's a bigger issue, I think, at the middle school and high school because they have that freedom of movement changing periods, whereas CIS and Randy, it's pretty well controlled. You're right across the hall, and the teachers kind of guide them to make that movement. Where here, they come out, I need to run over here and drop this off to my teacher because I forgot, and then I run back down the hall. It's a little more controlled, I think, in their setting. But I agree with that side of it as well, is consistency.
And, it may be that Ms. Davis walks around the high school and does not see the consistency and speaks to her teachers and says, hey, let's maybe encourage more masking in more places where you thought you could have gotten by with it. But where it would benefit is kindergarten teachers who are speaking to kindergartners. And, whether you believe it or not, I mean, there's got to be some benefit to a kindergartner being able to see their teacher's face when they are being taught. Same could be said for first grade and even second, probably. So, a less overruling mitigation plan like this gives that flexibility to some who could definitely benefit from it.
Have there been any studies reviewed about how much oxygen the masks cut off and how that affects brain development, dog, warning, people's emotions through facial expression?
There is research probably both ways, and I think a lot of the oxygenation studies most studies are going to tell you, no, it doesn't make a whole lot of difference. I mean, I can tell you from myself wearing an N95, it is hard to breathe in an N95. These students are not being required to. There is some definite research as far as jaw development. I see it every day. Kids who breathe through their mouth more, which are forced to through mask, are going to have underdeveloped mandibles. And there's research both ways on that one too.
So Millicent and
Basically what you're saying is that high school, middle school, and math.
They're not going to have much of an option.
We're overcrowded.
As far as space goes, I mean, we don't have enough room.
Well, can we influence them or maybe allow the teachers to have some classes outside some days? Get some breaks, is that possible? They just distance outside.
Sure.
Get these kids some breaks. I don't want to take my kids out of school, but I don't want to mask all day.
I think that's something they've always had an option. I know a lot of the teachers, especially the last half of last year, just because of how crazy it had been, did some more of the outdoor, especially like science classes. It was great. My oldest was a freshman last year, and they were out routinely the second half of the year.
Gym, you know what I mean?
They can definitely. Cafeteria, hallway, lobby, I mean, they can definitely rotate through there so they can take it off and do stuff like that. Sure.
Walking around last week, I know most teachers are really happy not to have to wear a mask and are probably going to be happy to be creative in ways to find opportunities to take a mask break.
Stuff set up so we can utilize those and set the schedule where they can definitely do. And if there's plans, we do have some, like I said, smaller classrooms where, we have a lot smaller classrooms, but classrooms where if they have room to 3 feet, they can do that and not wear them. For sure.
And you're gonna revisit it every month.
Yeah, and it's got to get revisited every month anyway. I think it's not lost on the people sitting up here, the argument of not wanting my kid to have to wear a mask every day. Believe me, I don't want either one of mine to do it. I have to wear one at work and I can't stand it. But I think for me personally, what the overriding factor is, if we can eliminate that huge amount of quarantines that we have right now, that's going to set our children even further behind than last year did. We're at week 2 of kids who are, we got one that's in AP chemistry. Second day of school, gone out, having to do worksheets and come up with a way to teach it. You can't teach AP chemistry through Google Classroom on a worksheet. That's, it's just a class that needs instruction from an educated instructor. I think what you presented, Dr. Farrell, was to me is a fair starting point, a fair compromise for now. If the option to not have to mask is there, they can use it. Otherwise, we've got to find some way to reduce this quarantine, and there's just no, I don't see any other way around it, common sense wise, to keep having this many children out week after week after week.
Yeah, another question.
Joe Farrell?
Yes, ma'am.
I feel like if we don't start the mandatory masking, we're going to be, even if with the whole 3 feet thing, we're going to be right back here in another week or two, and the cases are going to be even worse. The quarantines are going to be even worse.
How are the quarantines going to be worse if we're following the mitigation measures that eliminate?
Because I truly believe that we need the mandatory masking. And again, I can tell you, you can be for a mask, you can be against a mask. Either way, just like Purcell, I have to wear a mask all the time. I don't enjoy it. I don't consider it a muzzle. I don't consider it being good versus evil, or whatever other way it's been presented to this board. I just see a mask as something that I can do to prevent the spread of this virus in our community. I see it as something that prevents our healthcare system from being overwhelmed. I see it as something that protects grandparents and parents and children. And maybe kids haven't been that sick, but they are starting to get a lot sicker. And there have been more cases. I was just talking to a physician today, actually, that was telling me about a 16-year-old being intubated that was more than likely going to die. A 16-year-old healthy athlete. And, I would hate for that to be one of our 16-year-old healthy athletes in our school system. And it's a mask. It's just a mask. It's not political. It's not anything. It's a mask. I don't enjoy wearing it, but it doesn't hurt me. We need the kids in school. We need to cut back on the number of cases, and it's just my opinion as a healthcare professional that wearing a mask is what we need to do right now. Again, we can revisit it in another month. If it hasn't gotten better in the school system, then, maybe we'll look at the 3 feet thing. But right now, we need to wear a mask.
Sissy, you know how much I love to debate you.
I know, thanks.
Very sorry for a 16-year-old in that situation. If this discussion were last year in February or March, it'd be a little bit different. I agree. I agree that a mask is an easy thing to do. But the 16-year-old and the 16-year-old's parents at this point have had ample opportunity to get a vaccine if they did not want the risk of COVID. The parents and grandparents of our students now have an opportunity to be vaccinated. So, that's, one of the problems I have with our authorities is, people do have a right to make choices for themselves. And at this point, there used to be long lines for vaccinations. Now there are not. Every kind of encouragement has been made for vaccinations, lotteries, giveaways, all kinds of stuff. And, it's to a point where the parents have to make a decision for themselves and for their children who are eligible to start making those decisions. Because, I asked the same thing I asked when we started talking about going virtual. It's like, where does this end? So, you know, I personally don't think COVID is just going to disappear no matter what we do for a very, very long time.
I hear what you're saying, Banks, and I definitely, it is, as far as getting a vaccine, I do think that, that is a personal choice, and it is an option that people have to protect themselves. But you have children that are under the age of 12 that don't have that option right now. And so, again, it is different. This time last year, it was different as far as, the options that were available vaccine-wise. But we need to do what we need to do to keep our kids safe and to keep them in school. And I think that these numbers, they've done nothing but climb in the last 9 days. They're not going to get better. This variant is much more contagious than the Alpha. It's very contagious. And for every 2 to 3 people that the initial COVID virus infected, this variant infects 8 to 9 people. So we have to be careful and do what we can to stop the spread. And kids 12 and under can't get vaccinated. And so you may, I don't know, Banks, there are no easy answers. I don't like arguing with people. I hate to have these conflicting opinions, but as a healthcare worker telling you what I see, we've got to do something. And we can't keep going on like we have in the school system for the last 9 days because we see where it's leading.
I have to agree with Tiffany on that because the nurses in the school system, and I think I can speak for all of them, we've been completely overwhelmed for 9 days, more so than we were the entire year last year, partly because of this variant, the Delta variant, being much more transmissible. We have seen that in 9 days. Not only that, as she said, not all children can get the vaccination, but we have a lot of children in our school system who live with grandparents and they are at risk. And people who are vaccinated are also getting COVID. And so I have people, as Dr. Warren said, the people are getting younger who he's seeing in the ICU. People that are my age, and I don't think I'm that old, are dying in the ICU. And these are the people those kids are gonna come home and take it to. So the children themselves may not be getting very sick. We've had some of our staff be very, very ill from this variant. So my thing is, not only do I wanna reduce the amount of quarantines and keep the kids in school that don't need to be gone, but I want to keep everybody safe. And I feel like with the surge, the way it is now, it's almost just as bad or worse as it was in January and February. That's my opinion. And that's all I have.
Ma'am, one more comment.
Yeah, just to add on to what Laura and Cynthia both said, and I'll tell you, I'm coming from two perspectives. I'm coming to you as a doctor of physical therapy who works in the hospital, and I'm also coming to you as a parent of a child who has a condition. That means I have a letter from her specialist. If she were to contract COVID, it could kill her. She's 8 years old. She has no ability to be vaccinated. We have done everything we can to make her as safe as possible. We're vaccinated. My children wear masks to school. My children were home doing virtual school from March of 2020 up until August. In hindsight, looking at the numbers in the past 9 days, my child would have been safer in school last year with all the precautions that y'all had in place than she has been in the last 9 days. It has been stated here by administration tonight that we can do the best we can do, but we can't guarantee those 3 feet. Well, guess what? My child's life is more important. So are we here to look at the toolkit and do the bare minimum? Or are we here to try and take a measure to reverse what we're seeing in our community in the past 9 days? Get the numbers down, keep our children safe, keep them out of quarantine and in school, and give our kids the best opportunity to learn in a safe environment. We can say we're here to do a bare minimum and come back in another week or two, like Sissy said, and then have to push even further. Or we could take the step now and try and do something to reverse it. So I would just encourage you to think about the children who are at high risk. Her condition affects the body. She has a concave chest. It literally affects lung function. If she were to contract COVID, she could die. My 8-year-old child. So not only is she exposed to everyone that she's exposed to, but her brother, who's 11, who is also not old enough to be vaccinated, is exposed to his classroom. So if we have a slip in the 6th grade and we have a slip in the 3rd grade, it could be deadly for my child.
And she is not the only child who has 3 different conditions that was working in COVID. There are other kids in Granby who wear masks and they see their teachers. They know what the dangers of COVID are for them personally. And they see their teachers, they see administrators, they see them without masks on. And their kids know.
And my child's not afraid of COVID, but my child is educated. Because she has an educated mother and an educated father, I see what COVID does to patients. The 4 people tonight that are speaking in favor of universal masking are the ones that are working directly with patients with COVID and the ones that are working in the inpatient setting, and we have to see what COVID is doing to people. We are seeing it firsthand. We're also reading the literature. I'm not going to preach all of the research studies because you can read them, I can read them, we all can, but our numbers speak volumes. 9 teachers in Granby. Universal masking in place, you can present those what ifs on the exceptions on the 3 Ps not being able to be followed. So I would encourage you to at least consider, you have to revisit in a month. What is the harm if most of the schools are going to have to follow masking all the time anyway, unless they're outdoors? And if in most situations in the school, if they're not sitting still at their desk, and those kids, look at their schedule. They're not sitting still for hours at a time. They are moving from this class to that class. There's constant movement. So I would challenge you to just think about, if kids are wearing masks the majority of the time anyway, what would be the harm in a month of wearing those masks universally to help get these numbers down and get this moving? And during that month, talk to the parents, encourage them, revisit the necessity if they're quarantined to keep them home. If they're isolating because they're COVID positive, keep them home, not just from school, but from the community. This is our time that we can be proactive. Right now, we're just trying to play catch up and we're being reactive. Why don't we take a proactive step and do universal masking for a month and try and benefit the safety, well-being, and education of our children?
So, I just want to say this. COVID was new to all of us. We've all educated ourselves about COVID together. So I understand where you're coming from. I know that my nephew is diabetic. He is prone to just as much as any other kids that have pre-existing conditions. But it's a very minimal amount. If I'm an educated parent and I'm concerned, and masks haven't been working, we're still having numbers go up on tests that don't even test for COVID. You're still having your kid in the school. I'm not going to have my kid in the school, period. If they're prone to get COVID and the masks aren't working, I'm not going to have them in the school. Period.
It upsets me too, because I'm emotional like her on the opposite side.
I understand, but this is our open meeting. If we're allowing you time to speak, if you're going to speak, you speak to us, not the audience. I appreciate that. Thank you.
So, I don't want y'all to be put guilted into saying that, just because there's a small amount of kids, that the rest of the kids have to wear a mask and suffer through that, because my kids don't want to wear a mask. I'm sorry. I don't want them to wear a mask. I think it's more harmful than it is helpful. It's theater to me. It's theater, because the cloth mask, I wear one every day too, the job that I do. I have to take a break from it to breathe and catch up some oxygen outside of 95-degree weather. So I know what it is. A mask actually filters the air. These cloth masks aren't doing anything. It's not seeing facial expressions, not smiling, not communicating at all. I know what my son went through in his 9th grade year last year. He shut down and the teacher's like, you need to do something about it, make sure he's okay, stay on him, be sure you're talking to him, make sure his mental stability is okay. And I did. But in my mind, it's theater. I know you're going to be, you have to stay on these guidelines because of what the government says, but it still comes down to choice. And that's what I'll say in the future, it still needs to be, if I put the child in predisposition for to get sick and die from it, I'm going to take all the precautions necessary no matter what. And I understand that. But I don't have children with that. So my problems are mine. So I know y'all have the job of trying to get everyone's in the same boat and everyone coming together, but I know that's probably never going to happen. But in the meantime, I want my choice to be my choice, and y'all not dictate that.
Mr. Patel?
Does the superintendent have a recommendation we can call a question on?
Yeah, one more.
Oh, sorry.
Last one.
Joe Carroll.
Yes, ma'am.
Hey, sorry, there's kind of a little bit of a lag and I can't tell, I don't want to interrupt anybody. I can say that I'm not speaking out of fear. I'm speaking out of reality. I'm speaking out of the reality that I see every day at work. I'm speaking out of, the reality of our healthcare system. And, I'm not just talking about COVID-19. What I'm talking about is staff that is so burned out and in such pitiful shape right now that when your parents have a heart attack or you have a heart attack or whoever has a heart attack, nobody's going to be able to come in. Nobody's going to be there to take care of them because all the beds are going to be full with COVID patients. And you just don't know how bad it is. And so you don't know how I feel. And any healthcare worker that's in a hospital setting or even in a primary care setting right now, and like even public health, we have had all we can take, and we need to be doing whatever we can do out in the community to lessen these numbers. It's not fear, it's reality.
Yes, ma'am, in the blue. You'll be the last speaker for any public debate.
Guys, I see both sides. I understand people that are scared to death. I understand people like myself that are not. The vaccinated wearing masks are getting sick and they are dying. The unvaccinated are getting sick too. And it should be my choice to send my kid in a mask or not having a mask. And when my kids leave here, if you're worried about all the other people, when my kids and all the other kids leave here, where are they going? And are they wearing that mask all the time? It's a hard decision to make, but there's a lot of factors that go in it, and it's not easy, and we can't listen to one side either way and make a decision based on that. It's a fact. I know people that are vaccinated, wear the mask, and stay home despite their job, and they're still getting sick. And when the booster shot comes out, and those people are getting that too, they're still gonna get sick. This problem isn't just gonna go away anytime soon. I don't think so. I just think we should be thinking about how this is affecting the kids, and the kids are not the part of the population we should be most worried about. So let's send them to school where they have some sort of normalcy.
It is part of the population. I've told the county commissioners this in discussions with them and some of our state, they keep telling you, we were elected to represent more than just the school system. And that's great. I understand it. We weren't. We were elected to represent the kids, the parents, and the staff in the school system. It's not an easy decision across either side of the aisle. And it's not, like I said, it's not about the cases declining, increasing, whatever. It's the number that is hitting most of us the most is 17% of our kids out that aren't sick and haven't gotten sick, but they have to because they're not wearing a mask or they're not the 3 feet apart. And that's basically what I think our question comes down to tonight. Does the superintendent have a recommendation to call a question for?
I think the superintendent has presented the COVID mitigation plan.
Or call the question?
We gotta have a motion on the floor to call a question.
Correct. So it's in-
No, I'd like to point out one more time, if we pass this mitigation plan, it is based on Governor Cooper and Secretary Cohen's toolkit, which follows the signs. They've given a 3-foot minimum distance of social
Or
distance.
masking.
Or masking. We are following their guidelines. And as a system, we will do the absolute best we can with everything we do, as far as educating our students, keeping them safe, all of the above. So therefore, I'd like to make a motion that we approve the mitigation plan as presented.
We have a motion by Dr. Banks to approve the COVID mitigation plan for 2021-22 as presented this evening by Dr. Farrell.
With the caveat, just to make sure everybody's clear, we will revisit this monthly per the statute, correct?
Yeah.
So we're not approving it. We're
That's-
approving the current.
We have to do that. That's gonna be on our agenda every board meeting.
That's per
Until we-
statute.
Take it.
Second.
Seconded by Mr. Purcell. Is there any further discussion? Mr. Purcell.
Discussion as implementation would be tomorrow, next Tuesday, effective immediately.
Yeah, I guess we have to come up with that.
I do have a question, I just want to make sure it's clear. The plan I'm looking at, I'm just trying to figure out where the exception is that allows you, that does not require students to have masks on.
That's the part I asked you about and you read.
No, I was talking about the toolkit. What I'm looking at is
Oh,
where it here.
It's not in
mitigation
R.
plan.
I got you.
Because the mitigation plan, the new language is Camden County Schools is mandated masks for all people regardless of vaccination status. I'm trying to find where the exception to that is.
I see.
It's at the back where
Yeah.
presumptive or handling possible suspected or presumptive cases. If you go almost to the, it might be the next to the last
So it's gonna be
page.
where you have quarantine requirements.
Yes. Yes.
Chair Farrell,
Yes, ma'am.
what we are voting on right now, just, sorry, I need to just clarify this. This is for the 3 feet and not having to do the mandatory masking unless you cannot maintain the 3 feet.
Yes.
And if they cannot maintain 3 feet or they're moving about within 3 feet, is mandatory masking.
They would have to put their mask on.
And all I'm trying to make sure we're clear on is the way that's accomplished in here is by that being the exception to the quarantine requirement. I just want to make sure it's clear.
In the, yeah,
Yeah.
in the CDC or
Yeah.
the government.
Were you suggesting that it should be in the section on masking as well?
My only concern is if someone says, if they point only to this sentence here that says they're mandatory for everyone.
It should
are they
read,
gonna
they are
have to
mandatory.
There's some exceptions.
Oh, I know what's happening right now. So it's probably going to be as amended.
Okay.
Because as amended would read, except where minimal social distance, and this is under the masking,
Yeah, that's-
except where minimal social distancing as defined by the Strong Schools or Strong Schools North Carolina Public Health Toolkit can be achieved, Camden County Schools is mandating mask use by all people.
Okay.
So it would be as amended.
So that's going to be, that amendment will be on page 3, right?
Yes.
I'm going to recommend that you either withdraw the motion or amend the motion to make it clear that you're adopting the mitigation plan with that amendment. So there's no question but what plan has been adopted.
So I will withdraw the motion and resubmit the motion as amended by Mr. Lighty to include that language.
second the new motion.
So Dr. Banks has made a motion to accept the COVID mitigation plan for 2021-22 as amended under Mr. Leidy's recommendation.
To
On
begin.
page 3, we'll have to make an amendment. Seconded by Mr. Purcell.
We have to make an amendment for a start
Again,
date.
sorry, I don't have it in front of me.
But this would require masking in most places.
I'd have to just have the superintendent read that sentence again, so that clarifies it.
So the document that you probably have in front of you does not include the language except where minimal social distancing as defined by the Strong Schools North Carolina Public Health Toolkit can be achieved. Camden County Schools is mandating mask use for all people. The one that you had earlier did not include that language. So that's why it would be as amended.
So at 3 feet, they don't have to wear a mask.
Correct.
Correct. That's what the current motion is to approve. Yes.
Any further discussion?
I think back to, when does this go in effect? Would be, when do we want this?
Once this motion is finished, you can make a new motion or you can make an amendment to the current motion.
Okay.
We'll make a new motion.
Yeah.
And this is the one question that I did not ask principals, that they all seem to be looking at me with an answer right now. So
Yeah, do y'all have masks to hand out already?
I think Tuesday is logistically.
Tuesday's fair to the parents, I think. Might have to run out and buy masks now, unless y'all have a abundance of them. But I think. Well, what are your suggestions as administrators?
We have a lot of masks, but I don't think it's fair to families to try to implement this tomorrow.
Yeah, that's what I'm saying.
It's 8 p.m.
Yeah.
7:30, 7:40. Okay, so there's a motion on the floor, and we're going to make a new motion for the start date, not amend this one. Okay.
So Dr. Banks is again rescinding his motion.
No, we're gonna go.
Make a subsequent motion after this.
No, we're going to
Okay,
vote on
okay.
this one, and
We'll
if
make
it
a
passes,
second.
then make a second.
So we have a motion and a second?
Yes.
Yes.
I don't have
Any further discussion?
And Mr. Chair, you should take a roll call vote since we're having a member of the board participate.
Correct. All right. So Ms. Kuchar, would you call the roll for a vote? Yes.
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 No.
All right. Motion carries.
Make a motion that the newly adopted amended policy is set to begin Tuesday, September 7th.
Right.
Yes, 7.
So Mr. Purcell has made a motion that the COVID mitigation plan for 2021-22, as adopted by previous motion, will begin on Tuesday, September 7th, 2020.
Second.
Seconded by Mr. Heath. Is there any further discussion?
I guess you'll send out like a bright arrow to all the parents.
Yes, we'll communicate. Yes.
That's it.
Ms. Anita, you call the roll for vote? Yes.
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 Well, I guess I should vote no for that too, huh? I'm not trying to be funny, but yeah. Yeah.
Motion carries. That concludes our open session agenda. Is there any considerations for closed session agenda?
Make a motion to recess open session and go into closed session.
A motion by Dr. Banks to recess open session to enter into closed session.
Second.
Seconded by Mr. Heath. All those in favor say aye. Opposed? Motion carried. We're in recess.